Oral hygiene and the fresh breath are associated with a path to be healthy and our daily habits. Over time, poor dental care will cause mouth odor. The foods we eat contribute to bad breath too. However, bad breath may be a symptom of a health condition also or a side effect of some medications. Most people aren't aware of the fact that over 50% of the bacteria found in the human mouth contributes to the bad breath. Every year on August 6th, the world celebrates the Fresh Breath Day. This day is observed to educate and make people aware of these other factors, like for so many factors which actually cause bad breath, and some factors that can ensure the good oral dental hygiene that can ensure a fresh breath. We at MediCircle are conducting a series on the National Fresh Breath Day awareness series where we are trying to create an awareness about oral hygiene and also oral care among the general public. Hello, I'm Smita Kumar, and today our guest for the talk is Dr. Rathika Rai. Dr. Rathika was a former principal and HOD of Dental College in Chennai and was a clinical head and consultant with Apollo White Dental. She has done her MDS in prosthodontics from A.B. Shetty Memorial Institute of Dental Sciences, Mangalore. One of the goals she achieved while her tenure in dental college was it was the only college in the city to have full admission in BDS and MDS in the year 2020. So hello and welcome to MediCircle, Dr. Rathika Rai.
Hi, Smita. Thanks for inviting me over. It's a privilege to be here and especially talk about halitosis on the occasion of Fresh Breath Day.
Sure.
Halitosis, as we all know, is a very common disease which is occurring. So I'm sure, it's a very apt thing to happen on the Fresh Breath Day. Yeah, thank you.
So to all our viewers who have just joined in and who are watching this video, it is like we are having the series on National Fresh Breath Day. And everybody wants his or her mouth to be fresh, and the odor should be also perfect because it is the first time. It makes a very good impression if the odor is good, and if it is not, it actually leaves a very bad impression. So fresh odor is just not concerned for the youngsters but for everyone. So do like, subscribe, and share this video and our channel MediCircle for more such relevant information on health, and especially oral and dental health, which most of the people sometimes take a back seat, and they are most worried caring about the other things. But this oral and dental hygiene takes a back seat. So again, talking to experts here to know the factors, what are important to be taken care of when we are talking about fresh breath. So to begin with, Dr. Rathika, kindly tell us more about halitosis or foul breath.
Yeah, halitosis, as we are all aware, is bad breath or bad odor.
Yes.
And it is a very common condition that is present in majority of our population. Now, it seems as a very simple oral condition, but it causes a lot of embarrassment and distress, and also creates a low self-esteem amongst patients when they have bad breath. So it is nothing but a very offensive odor that emanates from the body, which may be due to oral or extraoral causes. Not generally oral, it may be due to extraoral causes also. So it is, there are different types of halitosis. So halitosis, broadly, we can classify them as genuine halitosis and something called a pseudo halitosis. Now, pseudo halitosis, I will try to just cover that up. Pseudo halitosis, as the name suggests, pseudo is false, So basically, the patient does not have halitosis, but he thinks that the other person is perceiving his bad breath, So he has a phobia about his bad breath. So that, that he's, even though he does not have halitosis, he perceives that the person sitting next to him is smelling his breath as bad. So in these conditions, basically, we do not require any major dental procedures. It just requires reaffirming the oral hygiene procedures which the patient has been following and giving a reassurance and confidence to the patient that everything is fine with him. So this is pseudo halitosis, because generally the patients think, oh, I have bad breath, and you try to hold yourself back. So yes, they come to you without any problem. So when you check them, they will have absolutely no problem. And so you need just reassurance and reaffirming their regular oral hygiene measures.
Definitely.
Then you have this genuine halitosis. Now, genuine halitosis again can be of two varieties. One is a physiologic halitosis. Physiologic means something that is happening within the body that emanates the bad odor, which is again a normal process. The other one is a pathologic halitosis. Pathology means there is some kind of problem within, and that is generating the bad odor.
Okay.
So physiology is a normal body process that leads to a bad odor. So physiologic halitosis is something like sometimes, when you get up early in the morning, you suddenly feel you have bad breath. That is mainly because during the night time when, sometimes the salivary secretion, the fluid in the mouth, that reduces, that tends to kind of activate the bad bacteria in the oral cavity, and that generates a bad breath. Sometimes even the food we intake, pungent odor is emanated, especially when you eat onions and garlic.
Yes.
You have a very bad odor that comes out. So these are very transient. Even smoking and alcohol at times tend to give rise to bad breath. These are very transient kind of halitosis, which can be handled with simple measures like your regular brushing and using a proper mouthwash, and that can be handled. Maybe if required, you can visit a dentist, but this is solved with just after a period of time, later after a small period of time, the halitosis will disappear. Now coming to the pathologic halitosis. Pathologic halitosis is basically because of some inherent condition in the oral cavity. So the primary cause of this bad breath halitosis is poor oral hygiene. When I talk about poor oral hygiene, that is your improper brushing, improper maintenance of your teeth. So what happens when we generally eat food? The food forms a very thin layer around the teeth. It is called a plaque. It's a thin biofilm. And this biofilm actually harbors a lot of microorganisms. So when you're brushing, you're basically eliminating the biofilm. So failure to do proper brushing will cause accumulation of this plaque, which over a period of time will form a thick calcified layer called the calculus or the tartar in the general jargon. So this calculus, what it does is it starts affecting the gums, and slowly, if unattended to, will start infecting your underlying supporting structures as well, and thereby cause infection of the gums, infection of the underlying supporting structure, which we call as the periodontium. So this infection, we call it as periodontitis. So when these conditions happen, so the microorganisms start developing, start collecting and forming, and this starts developing into a very bad odor, very bad halitosis, which will require aggressive treatment procedures. So this is one of the primary causes of bad breath, that is poor oral hygiene, very poor oral hygiene. Another cause could be a untreated, open, deep dental cavity, tooth cavity. You have a tooth cavity which has been unattended to, but it has not caused you any pain, so you have left it like that and you're carrying with your routine. So when a deep open cavity is left, again it acts as a nidus for attracting food, which again will not be eliminated during your brushing or your rinsing procedures, so continues to remain there, and that again generates halitosis. Dental abscess, this is another condition which kind of generates bad odor. Apart from dental abscess, another cause is the biofilm on the tongue. Now, tongue, again, as I told you, when you don't do proper oral hygiene measures, so layer of food forms in the tongue. So this again forms a thick layer, and this starts again developing into halitosis. There is another condition called pericoronitis. Now, this is another very common reason. This pericoronitis is nothing but a condition where when your wisdom tooth erupts into the oral cavity, when there is lack of space, it tries to push across, break through the tissues. So in the process, a small pouch is formed between the tooth and the tissue. So this acts again as a pocket. So unknowing to the patient, what happens? The food starts collecting inside, and again, it starts creating this bad odor, forming the microorganisms which start developing into bad odor. Another condition, very common cause for bad odor, or halitosis is xerostomia or hyposalivation, we call it. That is, as the name suggests, decreased amount of saliva. Now, saliva is a very, very important medium in the oral cavity. It acts as a buffering agent. It acts as a cleansing agent. It also as a lubricant, because when saliva is present, it lubricates the entire mouth. So when saliva reduces, it also helps in maintaining the, as we know, the oral cavity is a hub of millions of microorganisms, good and bad. So when the salivary content is reduced, these microorganisms increase in the level, the bad bacteria. So these microorganisms, what they do is they react with the organic components present in the saliva and other fluids in the mouth, and they generate certain volatile compounds. The volatile compounds such as sulfur. Okay. So sulfur is one of the volatile molecules which are present, and this sulfur is responsible for your bad odor. The sulfur also is present in our onion and garlic and other stuff. So the sulfur is what gets into the bloodstream, and thereby it is exalted as bad odor, halitosis. So xerostomia is also caused mainly because of certain medications also. That is, reduced salivation also happens because of some medications which you take for anti-diabetic, antihypertensive, diuretics, antipsychotics. Even during chemotherapy and radiotherapy, also there is a decrease in saliva. So when saliva reduces, the microorganisms tend to be more active and thereby start developing halitosis. Then, of course, this is the condition in the mouth which tends to lead to halitosis. Apart from this, halitosis also occurs when we are undergoing certain dental treatment procedures, such as, when a child goes for a braces, orthodontic braces, the clips, what you call.
Yes.
So when you have clips in the mouth, again, you don't maintain good oral hygiene, that is, your brushing, food tends to get accumulated. Again, the cycle starts emanating this bad odor. Another reason is when you go for fixed bridges or dentures, fixed dentures in the mouth.
Yes.
So when you have multiple teeth to be replaced with a fixed denture, food tends to get accumulated. So everywhere, wherever there is a nidus or a pocket for food, it attracts food and fails to be eliminated with your brushing, tends to collect over a period of time and starts developing as your bad odor.
Yes.
So these are the basic oral reasons. Apart from this, even there are systemic reasons. Systemic reasons, as we are all aware, your tonsillitis, when you have a bad tonsil or sinusitis, you can feel it, you have a bad breath. And then you have upper respiratory tract infections, lung infections, even diabetes for that matter. Then you have this gastrointestinal problems which surface as a bad breath. So even these conditions, cause bad breath. So it is necessary as dentists for us to identify whether it is an oral reason or it is an extraoral reason. When the oral cavity is healthy and clean, then we need to think about the other systemic disorders which would have been the reason for halitosis. Yeah.
Yes, definitely. So how to improve the oral hygiene from a young age? Because most of the people actually, when they are entering college or like teenagers, they start experiencing that they are having a full breath or something like that. But as children, definitely they sometimes don't brush twice or they don't floss. There are a lot of reasons behind that. So how early we should be starting taking care of our oral hygiene?
I think oral hygiene starts right from the birth, because even as infants, I don't know if you have realized, we take a soft muslin cloth and wipe the gum pads,
Yes.
to see that there is no food, because you cannot use a brush. You use your thumb, index finger, and use a soft cloth to clean the gum pad. So it starts as early as that. And of course, definitely with the eruption of the first tooth in the mouth, then your visits to the dentist starts together. So at a very young age, till the child develops his psychomotor skills, till he is able to handle the brush by himself, he will definitely require an assisted help from the parent in brushing. And as always, we recommend brushing twice daily. And of course, giving healthy food and the proper diet is also important. Well, of course, that's a very difficult task with kids, to keep them away from, sweets and sticky food. But at least we can take care to see that after they consume this food, that they at least rinse the mouth. Yes. Because the only reason all these problems start is the accumulated food that continues to remain there and is not washed off, that's where your cavities, gum problems, bad odor starts. At
Definitely.
least, if not, I mean, we cannot keep them away from sweets and other stuff.
True.
But that at least they rinse them. We should make make them brush their teeth regularly.
Definitely. So, Dr. Rathika, what are some of the most important tips that you would like to give to our viewers to take care of, to maintain a good oral hygiene?
So I was just trying to tell you that we have to ensure that they do the proper brushing at least twice a day. And nowadays in the market, you have very attractive brushes, which makes brushing very exciting to
Yes.
kids, with all cartoons and some kind of apps and, so many things happening, videos which run simultaneously, so many hi-fi brushes which make it very attractive to the kids. And also some brushes which make it where, creating some noise to show that you're brushing the right way or the wrong way. So many things, the brushes have been modified so much. So I'm sure the kids also would enjoy brushing. So I
Yes.
think so long, that is the care that starts as early as, the child is born, the care. But visit to a dentist maybe once the first tooth erupts, and depending on the milestone, it continues. But a regular checkup and visit is mandatory. And that care, what we need to do is definitely has to be done at home. Yeah.
Just a quick question there. As you said, that brushing is definitely required, and as like even as small children can be assisted by their mothers or caretakers, like they need to brush. How? But as we understand that flossing is also very important. How early can we introduce flossing to our children?
Flossing also, it can be once the child has a full set of teeth. You know how the child primary teeth, they have 20 set of teeth. So long they have the teeth which are side to side intact, then you can also do flossing. But flossing again has to be done with a lot of care, because the process of flossing, you should be taking care to see that you do not injure the gums.
Yes.
So once that care needs to be taken to see that you do not cause more injury to the gum in the process of taking care of the teeth. So
Definitely.
flossing also can be started once you have the full complement of teeth, you can start.
Okay. Uh,
Yeah.
so the most important question, Dr. Rathika, like some oral care tips that you can suggest to our viewers to maintain a good oral dental hygiene.
Are you able to hear me?
Yes, yes, I'm able to hear you.
Yeah. Uh, Oral care, first and primary is, as we say, brush regularly, twice at least, if not after every meal, along with a proper force and a proper brush and a proper technique. These all three are important. We are generally under the impression that more force, better cleaning, which is not
Yes.
so. More the force, you're causing more damage to the tooth. So right amount of force, the proper technique, and the proper brush. You need to change your brush regularly. And of course, again, as I said, there are different types of brushes now.
Yes.
So even if you're compromised, you have these motorized brushes, you have this electric brushes, the sonic brushes, so many types of brushes. Any which way, brushing twice is definitely a mandatory thing, at least if not every meal, as I said. Along complementing to the tooth, also the tongue. The tongue also needs to be cleaned effectively every day. So these days, if you notice, the brushes the head of the brush has spikes at the back of its head. So you do not need to necessarily have a separate tongue cleaner, the metallic one, which in fact is a little hard and, little sharp at times. You're likely to injure your tongue also. So these spikes which come at the back of the toothbrush serves as a good cleaner by themselves. So this brushing and cleaning of the tongue should be together, along with which flossing. I think we Indians are generally not so used to the thought of flossing every day. So I always recommend my patients, if not every day, at least alternate days, once in 3 days, or at least once a week. So because flossing again is a very difficult technique, but again, there it has been made easier. You have this floss holders.
Yes.
So you need to know the technique. Only care during flossing is you need to take care to see that you do not injure the gums in the process of your flossing.
Yes.
Apart from that, you using the mouthwash. Again, mouthwash, you have an array of mouthwashes in the oral in the market. You have the medicated and the non-medicated. For your use, unless prescribed by your dentist, a non-medicated and regular oral mouthwash is fine.
Okay.
But otherwise, we have the medicated one, which is very potent, that is called the Hexidin mouthwash. Because these medicated mouthwash, once we prescribe to the patients, they continue it endlessly. But what happens? These mouthwashes over a period of time causes staining on the teeth.
Okay.
This is the medicated ones I'm talking, which is Hexidin. So that anything in overdose is not good. So keep in moderation and do it regularly. So these are the basic things with brushing. Apart from that, also insist you need to visit your dentist.
Yes.
Because we generally think that you don't have no problem, you don't need to visit the dentist. But as you know, or say that patients, the trend is, you visit the dentist only when you have pain. Otherwise, you never visit a dentist, right?
So I'm just asking, going to ask you this, like how often we should visit a dentist, because generally we visit a dentist only when we have some problem. Otherwise, we generally never visit.
Exactly, because I always tell my patients, don't come when you have pain, because pain is an indicator that the problem has reached its maximum, wherein it requires a very aggressive treatment, as in maybe a root canal, it may be an extraction of your tooth, or even maybe gum surgeries. So I always tell them, just come in between. If you do not have a problem, no treatment will be done. But if at least there is a very small decay which requires a filling, your problem is solved with a filling rather than waiting for the decay to go deeper and waiting, because when the pain occurs, it's a clear indication that the tooth is to be treated aggressively. It cannot be treated with a mild, simple treatment as a filling or a cleaning or, just polishing,
Yes.
So the patients do have to visit,
Just a quick one there, as you just mentioned that we need to keep changing our toothbrush and tongue cleaners. So being a healthcare expert, like especially an oral healthcare expert, how do we understand that this is the time to change, or is it on a periodic basis that the toothbrush and the tongue brush should be changed?
See, the toothbrush generally, depends on your force. So generally what happens, you can see the toothbrush, the tip gets flared. It loses its shape. That's a time when you know that your toothbrush needs to be discarded. At the same time, this flaying of your bristles is also an indication that you have been using too much of force. But again, as I said, the brushes these days, the bristles are very textured. So they are not like the earlier bristles, which were harder. So you do not find much of flaying of your brushes, but definitely after 2 months, I think I would ask my patients to change the brush, because the effectiveness definitely comes down with regular use.
Definitely.
Yeah.
So thank you so much, Dr. Rathika, for joining us for National Breath Day Awareness Series. We definitely hope that our audience would be working on their oral hygiene and maintaining a good oral care for them, especially brushing twice a day, also flossing. As Dr. Rathika very rightly said, we Indians generally don't tend to floss that often, like twice daily. So at least you can do twice a week or even once a week. So thank you once again, Dr. Rathika.
I also would like to add one more thing, Smita. Yeah, this is this halitosis when patients are visiting the dentist. Even apart from the 6 months and 1 year, we say, I would suggest that patients who have like this prosthesis, artificial teeth in the mouth, they need to visit the dentist even more frequently, because, again, as I told, food tends to get accumulated between these dentures and bridges. So wearing a removable dent, so they need to be cleaned regularly, and sometimes they require professional cleaning. Just cleaning by self cleaning would not suffice. So they will definitely require a professional cleaning, for which they have to visit. There is another very useful gadget that is used for cleaning called the water pick. So water pick again is a very useful gadget which is used to maintain. Basically, all these gadgets help to remove the food that is accumulated. As they say that the window is the soul to your, I mean, the eyes is the window to your soul.
Yes.
The oral hair cavity is a mirror to your health. So they say a healthy mouth is always a healthy body.
Yes, definitely.
So thank you, Smita. Thanks for that. Yeah, yeah.
Sure. So thank you, Dr. Rathika, for joining us. And we would definitely make sure that we brush and also floss, so that the window to our, like, when, as Dr. Rathika rightly said, that good condition tooth, it shows that you are very healthy. And ultimately, to be healthy, you have to chew food, and for that, you need to have very good teeth and gums. So thank you, Dr. Rathika, for your so important and valuable tips. I definitely hope that the viewers would find it quite interesting and important. Thank you once again.
Thank you, Smita. Thank you for inviting me on. Thank you.